Hello everyone, how are you all? I hope you all are doing great. Welcome back to our channel, and I am here, your committed friend Mukta, and today I am going to talk about a very precious topic that is related to our potential population. Do you know who are the potential population? Who are at risk? Is this we? Is this you? Is this women population? Yes, of course. We are the potential population. We are at risk. So, are you aware about the fact that in India, in every 8 minutes, one woman dies? One potential population dies. And do you know what is the disease by which one woman dies in every 8 minutes? This is cervical cancer. You know, my friends, this is one of the fatal disease, but it is 100% treatable if we detect or we prevent. If we detect in early stage and if we prevent it with the vaccine. So I know its causes. Do you know its causes? So it causes by human papilloma virus, HPV, human papilloma virus. So this is one cancer that is 100% treatable. So what are the symptoms? If you notice, then you should think about it is cervical cancer. So first of all, I would like to explain you what is cancer. What is cancer? Normally, our cell divides and grows in the disciplined way. But in case of cancer, it is divided in an uncontrolled way. It grows in an uncontrolled manner. And when it divides and grows in uncontrolled manner, then it clumps together and form a tumor. And when it spread from one place to other, one side to other side, then it is called the metastasis. It spreaded from one organ to another organ, other 2-3 organs. So that is called the metastasis. So which kinds of symptom if you will feel, then you should notice and will go to the doctor. So if there is a pelvic pain, if you will feel the excessive discharge or bleeding, discharge with foul smell, white discharge that is smelly, and if you will feel the bleeding between the cycle, after the menopause or after the intercourse, if you will feel pain in the intercourse, pain during the intercourse, this is also a symptom of this cervical cancer. If you feel excessive weight loss, if you will feel the exhaustive, fatigue, leg pain, so all these are the symptoms of cervical cancer if it is recur again and again, and if it is persist for more than 6 weeks. So in any of the situations, you go to the doctor and consult to the doctor. Don't take control in your hand, because in India, what happened? We as a women ignore our health. We will not take the priority. We take care of our family members, our kids, our husband, our other family members, even our relatives. But when the time comes to take care of us, we always ignore. We always undermine the signals of our body. And in this way, the stage advances from the first, second, and third stage. And generally, usually, in India, the women diagnosed in the third or fourth stages of cancer due to the ignorance, due to not come out of their home. They are always indulged in their household chores. They think, they feel, and actually they are very busy in taking care of their family members. So these are the symptoms. When we notice, we must go to consult to the doctor. Let doctor tell that it's normal. So as we know, it is causes by human papillomavirus. So there is two kinds of global strategy: prevention part and early detection part. So prevention, screening, and treatment. So 90, 70, and 90 rule are here by the global strategy of the WHO. So WHO gave us 90, 70, 90 rule. So we will vaccinate 90% of girl till the age of 14 years, 9 to 14 years of age, and 70% of the women will be screened at the age of 35 and 45, and 70%, 90, 70 and 90. 90% of the screened women should get the treatment and will get the palliative care. If we will work in this way, then we can eliminate and eradicate the cervical cancer till 2030. So there are three pillars of a strategy: prevention part, screening part, and treatment part. Now we will talk about the vaccination part. So there are three types of vaccine in 2 doses for the girl from the age of 9 to 14 years of age. So 9 to 14 years of age, 2 doses of vaccinations. We recommend the first dose at the first month, and the next dose we will give after the 6th month of the first dose. Like for example, if we provide first dose at the first day of the month, like 1st January, we administer the first dose of the vaccination. Then the second dose will be 1st July, after 6 months of the first dose. And at the age of 15 to 26 years, the vaccination will be provided in the 3 doses. First, 1 month or 2 months after the first dose, and 6 months after the first dose. For example, the first dose from 15 to 26 years of age before sexual debut, we will provide this vaccination to create the to occur the antibody to like in the girl population. If we administer the vaccination at the age of 9 to 14 years, so antibody will be produced in the body to combat the cervical cancer, HPV virus. And in 3 doses, 15 to 26 years, if we miss at the age of 9 to 14 years, then again there is a chance, there is an opportunity to provide the vaccination at the age of 15 to 26 years before sexual debut, before getting through any contact. So this should be in the 3 doses, like first dose at the 1st January, second dose at the 1st February or the 1st March, and third dose at the 1st July, after 6 months of the first dose. So in these 2 regime are available, 2 doses or in the 3 doses. And in the screening part, after 30 years, when the sex established, so it is the chance of getting infection, HPV infection, human papilloma virus infection. So the screening starts at the age of 30 years to till 65 years of age, 30 to 65. So mostly it is seen that at the age of 50 years, in the sexually active women, this infection occurred. So we should go for the screening. For the screening, we have the investigation, HPV DNA test and pap smear test. So HPV DNA for every 5 years and pap smear for the 3 years, or we can do in the combination HPV DNA and pap smears. So this is non-invasive procedure, and we can go 15 minutes procedure. We can get to know whether we are infected from the HPV virus or not. Human papilloma virus infection is there in our cervix or not. So these are some prevention part. And screening part, I already said that we should go for the screening by the investigation, and after that, if we will screen, then we will navigate for the proper treatment. As I said, 90-70-90 rule worked here. This is the global strategy given by the WHO, and we will work according to that, and in this way we will go for the treatment and for the palliative care. For the prevention part, we will also take the fresh fruits and vegetables, different colors of fruit. We will stop smoking. We will encourage the population to stop smoking, to go for the screening, to take the fresh fruits and vegetables and the proteinous food, and we can avoid excessive exposure. We can go for the exercise. So all these are for the prevention part, and there is no such clear evidence that if we will go for that, then we cannot get the infection. But at least we can boost our immunity to combat the disease, to fight from the infection, to fight from the disease. Unfortunately, if we will get through. So after that, as I said, for the treatment part, you should navigate for the proper treatment, and you will lead your life healthy and happy. You will save your life and the life of the loved ones. So these are some information. I am sure it must be beneficial for you. It must be added some value, some information, and stay connected for more such informational content. Thank you all.